Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show. Today we have a very fantastic person with us and we would like her to introduce herself to us.
Okay, hello everyone, it's nice to be here. My name is Dr. Helen Gary. Nice to be here once again.
Okay, so today Dr. Helen is going to be talking to us about diabetes. So Dr. Helen, what is diabetes?
Okay, diabetes by definition is defined as a chronic metabolic disorder which is characterized by chronic hyperglycemia as a result of absolute insulin deficiency, which simply means that a person has no insulin, or relative insulin deficiency, which means a person has insulin but it's not enough, or there's a problem with sensitivity of the cells, and this in total leads to problem with the metabolism of carbohydrate, fat, as well as proteins. I mentioned these three because it's important for people to know. Generally, if you ask people, they say, oh, it's a problem with carbohydrate. So don't eat rice, don't eat this, don't eat that. But I want everybody to know that it's not just carbohydrate that is our problem here. We also have problems with lipids as well as proteins.
Okay. So in your definition or introduction, you said chronic twice. Are you trying to hammer on this chronic? That diabetes is a chronic illness, that is a long-lasting illness, a lifetime illness?
Yes, it's a lifetime illness in this case.
Okay. So I'd like to know then, when you say diabetes mellitus and diabetes, is it the same thing? Because I hear people say diabetes mellitus while some people say diabetes. Is it the same thing you're talking about?
Okay, yes, it's the same thing they're talking about in this case. And then in our environment, people also call it sugar problem.
Yes, that's the famous one, sugar problem.
Yes.
Okay, so we also hear people say, I have type 1 diabetes. So are there different types of diabetes, and can you explain that to us?
Okay, so yes, there are different types of diabetes. I would like to talk about two specifically today, the type 1 diabetes and the type 2 diabetes. Okay. So remember in my definition, I said there's either absolute or relative insulin deficiency. So that's one of the things that differentiates type 1 diabetes from type 2 diabetes. So in type 1 diabetes, there's no insulin in this patient. There's no insulin produced in this patient. So they are usually dependent on exogenous insulin given to them. But in type 2 diabetes, there's some form of insulin, but two things are involved. That it's not enough insulin, or the cells which the insulin are supposed to bind to, they are not sensitive enough to the insulin that is produced.
You say exogenous insulin, that you're saying insulin from outside sources, right? Not what the body is making.
Yes, not the one that the body is making, outside source insulin.
Okay. So what symptoms will someone be experiencing that will, trigger them to go to the doctor and say, it's possible that I'm having sugar problem? Can you tell us these symptoms?
Okay, so in the medical field, we usually use something called the 3 Ps. Okay, because there is known as polyuria, polyphagia, and polydipsia. But I'm going to bring it down simple terms for all of us to understand, right? So polyuria is when you notice that you're urinating excessively, more than you would normally urinate, right? And then polyphagia is you notice that, okay, you're eating too much. Normally you eat maybe 2-3 times a day, but this time you're noticing that 4 times, 5 times, you still want to, munch something down. And then the next one is polydipsia. Now, because of this is excessive drinking of water. So that polydipsia is a compensatory mechanism of the excessive urination. So the more you urinate, the more your body wants to drink water.
Okay, you're drinking, you're urinating,
basically that's
one in, one
out.
Oh gosh.
Yes.
Okay. Then we hear always that people, when you talk about diabetes, right, people will say, oh, you're eating too much sugar. Because you're eating too much sugar, sugary food, sugary problem. But are there any other risk factors that can predispose one to having diabetes, apart from this, oh, you're eating too much sugar? Is it genetics, or are there other risk factors? And can you tell us about this?
Yes, okay, thank you for the question. So I usually, yes, there are other risk factors to answer your question. I usually divide them into modifiable risk factors and non-modifiable. What I simply mean is the things that you can control as a person are the modifiable risk factors, and the things which you can't control are the non-modifiable risk factors. So for modifiable risk factors, for example, is obesity. You can control it because you can exercise, you can lose weight, right? In this case. Okay, another modifiable risk factor is a person that smokes, or drink alcohol excessively. You can stop it whenever it is you are ready to stop it, right? In this case. Also, a person with sedentary lifestyle. So you're sitting down in a place more, you eat, you sit down and you walk for a long time. You're not moving around enough to be able to burn the fat, hereby leading to obesity in this case, right? Okay, so I'll now go to non-modifiable risk factors. This has to do with age. Right, because you can't change your age.
I wish I could modify.
I wish I could do the same too. So you can't change your age. So that's a non-modifiable risk factor. So things like age are non-modifiable risk factors. Also, a family history. So you see some people, their father had diabetes, their grandfather had diabetes, and they are at risk of having diabetes themselves, as well as race. For some reason, the black people, we have a higher risk of having it. It has not been explained why, but it is just what it is.
Okay, so how can we manage diabetes? Someone has diabetes, how do they manage it?
Okay, so for management of diabetes, I also like to divide it into pharmacological management and non-pharmacological management. What I simply mean is that as much as you come to us to help you manage this diabetes, there are things that you also have to do to help us manage diabetes for you. So non-pharmacological management are things like exercise. So if you're obese, we're going to tell you, even if you're not obese, it's just for a healthy, overall healthy lifestyle, we're going to tell you that please, you're going to have to exercise. Also, you're going to have to work on your diet. A lot of times we send people to dietitians, to give them a balance of, what to eat, how to eat it, and what proportion to eat. Those are the non-pharmacological methods. Now, for the pharmacological method, it depends on the type of diabetes that the patient presents with. Remember I said that in type 1 diabetes, there's no insulin. So there's nothing we can do for this patient but to give them insulin. That is the only thing that we can use to help them. Now, in type 2 diabetes, there are two routes to go about it. We have oral hyperglycemic medications, for example, metformin, Amaryl. These are medications that we can give to control the blood sugar in a patient orally. The patient takes it.
Take it like a pill you swallow.
Like a pill you swallow. But there are some cases where people with type 2 diabetes require insulin therapy also. So these are the two possible options for the management, pharmacologically and also non-pharmacological management.
So when people say, sometimes you hear that people have to have an amputation, especially of their foot, right? Because they have diabetes. Can you explain that? How does that happen? That somebody has this illness that, like you said, can be managed, right, by pharmacological means and non-pharmacological means, just taking a pill, just taking your insulin shots, and now we are hearing you have to cut off this person's foot. Can you relate that and explain it to us?
Okay, so sometimes there are two scenarios where this can come up. A lot of times we see what you're trying to talk about is what we call diabetic foot ulcer. Okay, that's what it's called. So what happens in this case is that a lot of times people that come down with this are those that are non-compliant with their medications. They're not compliant with their medications, they're non-compliant with the lifestyle we speak to them about, so they come down with it. So in what we tell our patients, or what we tell people, is that when you have diabetes, it's not a stigma, but you just have to know that you can live a very long and healthy life, but there's a way to go about it. So when you have diabetes, for example, and then we are trying to avoid this diabetic foot ulcer, you know that you're not going to be walking around barefoot. Because if something pricks your leg, the way wound heals in a non-diabetic patient is different from the way it will heal in a diabetic patient. We also will tell you that you're not going to be, when you want to bathe or something like that, you have someone test the water for you to make sure that the water is not too hot. Because the sensitivity, to avoid burns, the sensitivity in the leg of people with diabetes that have complications like peripheral neuropathy is not normal. So you can put your leg into hot water, you get burns, and you won't even know that the water is that hot. We also advise them that you don't wear tight shoes to avoid injury. In this case, you also advise them that you check your leg regularly, because people that have this peripheral neuropathy that I just spoke about right now, you can have an injury on your leg and not even know that there's an injury on your leg, and then before you notice, it has become a whole big issue. So you check your leg regularly, make sure that it's clean, make sure that it's just clean and everything, and then you try to comply with the medications that we also give.
So apart from the leg and the foot and the peripheral neuropathy you've mentioned, are there other body organs or body systems that diabetes affects?
So yes, thank you for that question. Diabetic is a systemic disorder, which simply means that it can affect from the crown of your head down to your leg.
Wow.
Especially when you're non-compliant with your medication. I'll keep stressing on that. That's what I am hitting on, the non-compliance with medications. So people can come up with something called retinopathy. Eye problems. You just notice that you're not really seeing very well, you're having blurry visions. Okay, you can also some people can come up with renal problems. So you notice in this case that when you are urinating, your urine is foaming. Okay, you're having either burning urination, painful urination, or you have pain at your loin part. Okay, those are also some things. And then some people, very important that I spoke about, you can notice that when you're walking, it feels like you're walking on pins and needles. Okay, you feel like you have pain at the back of your leg when you're walking. Also, these are symptoms of the things. These are chronic complications. For acute complications, you can come up with something else called diabetic ketoacidosis and hyperosmolar hyperglycemic state, but we won't go there today. We won't go there today.
For these acute ones, you come up with them, it's straight to the hospital,
right? Straight to the hospital. You come up, this is an emergency, so you come straight to the hospital, yes.
Okay. So, well, we're in Nigeria, right? And we don't usually do a lot of mental health, but I would like to put mental health here. Because he said it's a chronic illness, it's a lifelong illness, right? So someone who has just been diagnosed will be thinking, how will I deal with this lifelong? How will my family deal with this? And especially because they've been hearing things, like I said, this amputation, these, very drastic, dramatic things, right? So how can they, or how can you put mental health here to work with people who have diabetes, who have been diagnosed with diabetes? Should they see a counselor, or what can they do, and how can their family also help them and their mental health?
Thank you for that question. So when a patient is diagnosed with diabetes, we don't just tell you have diabetes, go home. So we sit with you one-on-one, we counsel you, we explain to you that yes, diabetes is a lifelong situation, but you can manage it. It's manageable. Aside from talking about the management, we also talk to your family members, the support system that you have, right? You tell them that, you explain the thing to them, just as you talk to the patient, you also talk to the family members and encourage them to support this person at this particular point in time.
Thank you very, very much, Dr. Helen, for coming to the show today and talking to us about this very important topic.
Thank you so much for having me.
Thank you everyone for watching this episode. We would like you to follow us on all our social media handles. Please click the subscribe button and the notification button so you can always get up-to-date content. Bye.
Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.